Thank you for coming here today. My name is Nickie and I'm a state representative. Since the Affordable Care Act became the law of the land, it's been under constant partisan attack. Republican congressional leaders continue to run a campaign against health care reform based on lies and dependent upon a level of propaganda that is obnoxious to say the least and unproductive at best. I want to thank Protect Your Care and Organizing for Action today. What groups like this are saying to the gerrymandered GOP, the GOP which the definition has becoming defined as the great obstructionist party, more and more each day, leadership in Congress and Ohio, to the GOP we say, if you won't tell the truth, if you won't help people understand Obamacare, we will. Councilwoman Cleveland, Mallory McMaster, and I are here today to talk specifically about the Affordable Care Act and a focus specifically on women's health. Unlike the Ohio GOP and Republicans in Congress, this law takes women into account for the better. Consider just a few features of Obamacare that Republicans are not talking about. At least 1 million women ages 19 to 25 who were previously uninsured have been able to get coverage through their parents' health insurance. In 2014, nearly 19 million women in America will have opportunities for health coverage through the health insurance marketplace in their state. In 2014, insurers will no longer be able to charge more or deny coverage to anyone due to pre-existing conditions. The Department of Health and Human Services estimates that there are more than 5 million non-elderly Ohioans who have some type of pre-existing condition, such as asthma or diabetes. In the state of Ohio, what we've seen is that sometimes a pre-existing condition can just be being a woman and trying to access health care. In 2014, an estimated 8.7 million American women currently purchasing individual insurance will gain coverage for maternity benefits. Beginning next year, insurance companies will no longer be able to charge higher rates to women due to gender or health status. Now, if you are not aware that women have been paying more for health insurance than men, I want you to consider just a few takeaways that we had from May of 2012 and a research report from Innovation Ohio. A typical 40-year-old woman buying an individual policy pays anywhere from 20 to 50% more than a 40-year-old male in the state of Ohio. 60% of insurance plans sold in Ohio charge non-smoking women higher premiums than smoking men. I'm going to say that again, male smokers. 60% of insurance plans sold in Ohio charge non-smoking women higher premiums than men who smoke. Gender rating markups vary widely between plans, calling into question the actuarial justification for rate increases for women. In addition to driving up costs for individual policyholder, gender ratings increase group insurance costs for many small businesses, particularly those who employ large numbers of women. 14 states have banned or limited gender rating in the individual insurance market, while 17 have done so for group insurance plans. When this study was released in 2012, I was shocked. And with my colleague Nancy Garland, who was then also a legislator, we introduced a bill, House Bill 551, that would prohibit insurers in the state of Ohio to consider gender when they're determining premium rates. Simply put, we went to the GOP-controlled House and asked for a vote to stop gender discrimination in this regard. If you followed this legislature's record on women's issues, you already know where that proposal went. Unfortunately, it went absolutely nowhere. Since 1999, the cost of health insurance in the U.S. through the premiums that you and your employer pay has risen 186%. Does that sound like a rational marketplace to you? It doesn't to me. One would think that our state's leaders would be putting their shoulders to the wheel to make health reform work for Ohioans. But we know that's not the case. Congressional Republicans have voted over 40 times to repeal Obamacare, casting votes they know are meaningless and wasting both the public's time and, I think, creating a fatigue for the public, rather than rendering constituency services. This amounts to carrying the water for big business interests and extremists. We're seeing this play out right now again. Then we have Governor Kasich, Lieutenant Governor Mary Taylor, House Speaker Bill Batchelder, and Senate President Keith Faber. They've turned Ohio into ground zero in the war on women, in the right wing's efforts to put roadblocks in front of health care anytime it affects advancing access to health care. For example, Kasich refused to exercise the state's right to run its own insurance marketplace. Through a variety of actions and inactions, Lieutenant Governor Taylor has used her position at the Department of Insurance to thwart health reform. I serve on the Health Committee for the House, and we asked numerous times for her to come and talk to us specifically about creating an exchange in Ohio. But our request fell on deaf ears. They refused or just never came to our committee hearings, and creating an exchange that would work for all Ohioans was not something that happened as well. In the legislature also, Speaker Batchelder and President Faber have killed Ohio's opportunity to expand Medicaid. We all know the details. The federal government would pay to get expansion off the ground, providing more than 250,000 Ohioans health insurance. According to the Plain Dealer just today, turning away $13.5 billion in aid to Ohio over the long haul by not forwarding Medicaid expansion. And we know that the governor has the ability to get this work done if he wanted to exercise that leadership, but it's not happening. So we're here today to say enough is enough. If there are improvements to be made to Obamacare, Democrats at the state and the federal level are ready, willing, and able to make that happen. We're ready to discuss improving the law at any point. But with so many good things in the law, especially for the women of this country and for the women of Ohio, repealing or disparaging the law is simply not an option. It wastes time, it creates fatigue and confusion for the people of our state. The health insurance marketplace opens on October 1st. The health insurance marketplace opens on October 1st. Consumers can sign up now at hh.gov to get ready for enrollment. And now I'd like to turn it over to Cleveland City Council Majority Leader Phyllis.
Good afternoon, and thank you, Representative Antonio, for your remarks. You were on point and very poignant about what we're facing, what the women in Ohio are facing. I'd also like to thank Protect Your Care for allowing me to participate in this press conference this afternoon. In Cuyahoga County, an estimated 150,000 residents were without health insurance in 2011. Unfortunately, Republicans in Congress chose to throw up roadblocks and encourage scare tactics rather than do what their constituents wanted. For most Americans, what we have is a health insurance system rather than a health care system. Obamacare, the Affordable Care Act, is health care reform built around consumers, around the American people. Under the Affordable Care Act, since 2011, nearly 27 million American women with private health insurance have gained preventative services with no cost sharing. This is a new benefit for most women. Many health plans now cover well woman visits, gestational diabetes screening, domestic violence screening, breastfeeding supplies, and contraceptive services. In the 11th Congressional District, which includes my ward, 160,000 individuals, including 30,000 children and 72,000 women, now have health insurance that covers preventative services without any co-pays, co-insurance, or deductibles. The Affordable Care Act is indeed already working for many individuals in Cleveland, in the 11th Congressional District, and throughout our region. 6,400 young adults in the district now have health insurance through their parents' plans. More than 10,000 seniors in the district receive prescription drug discounts worth $13.5 million. Up to 41,000 children in the district with pre-existing health conditions such as asthma can no longer be denied coverage by health insurance. Up to 99,000 individuals with pre-existing health conditions in the district such as diabetes, asthma, high blood pressure have access to quality, affordable coverage without fear of discrimination. Again, open enrollment under the Affordable Care Act opens on October 1st, just days from now. I'd like to thank everyone who has taken a few moments to listen to what we have to say today about the opportunities that are brought to our residents by the Affordable Care Act. I'd also like to mention, just moments before this press conference began, we learned that Congress again took action. The House of Representatives passed a measure, a stopgap measure, to continue funding the federal government until December 15th. But tied to that is a provision to another blatant attempt to defund the Affordable Health Care Act. And we said this is unacceptable. This is a waste of taxpayer money, a waste of time. As Representative Antonio said, it causes fatigue and confusion among our residents and also among our employers. And we demand that our Congress act responsibly, that it does what the voters sent them there to do, to represent us, to take care of our needs, and to do the things that the American people need and want. And now I'd like to bring up our final speaker. This is a young woman who has a very personal story to share with us about the Affordable Care Act. I'd like to introduce to you Mallory McMaster, who's a student here at Cleveland State University, and she can share how she has benefited from the Affordable Care Act.
Thank you, Representative Antonio and Councilwoman Cleveland. My name is Mallory McMaster-Ullman. I am actually a student here at Cleveland State University. I'm here today because I'm very concerned about the constant negative partisan politics that have been surrounding healthcare and the Affordable Care Act. After the Supreme Court ruling, we know that the Affordable Care Act is our law. I expect my elected officials at the state level and in Congress to uphold it and implement it. As a young voter, I worry about things like getting to school, finding the right career, and paying off my student loans. It feels like my interests aren't even on the radar in Washington or Columbus these days. When I read about the repeated failed attempts to repeal the Affordable Care Act, the 42nd happened this morning actually, I can't help but wonder how great our health care system would be if our legislators had spent that time and money focusing on the implementation of the Affordable Care Act instead of fruitless efforts to make a political point. What I'm really here to talk to you today about, though, is the practical benefits that have impacted my life thanks to Obamacare. I'm only one person, but I feel like my story shows that there are millions of women in Ohio and around the country in positions just like mine that will benefit greatly from the Affordable Care Act. Like many young Americans, in my early 20s, I found myself without a job that offered health insurance. Thanks to the Affordable Care Act, I was able to remain covered on my mother's health insurance plan. She was more than happy to pay the extra $350 a month to make sure I was protected. I won't say that this opportunity didn't mean a lot to me, but I will say that I didn't understand just how important it was to have health insurance and be in the system until I got some really bad news. In early 2012, I was diagnosed with cervical cancer. Because I had health insurance, and because I was able to go to the doctor and keep up with my yearly exams, my cancer was caught early enough to treat with a reasonably good prognosis. because I had health insurance, I was able to go through my treatment without worrying about money or how to pay for it or when I'd be able to afford it. I was able to focus on my health, get the treatment I needed, and thankfully, I'm on the road to recovery. Because I was insured, I didn't have any questions about my treatment. There were no delays in receiving my treatment, and now I have a good outlook. I simply received the best care available. Here at Cleveland State, I know a lot of my fellow students are in the same situation I was in. What if my mother didn't have health insurance when I was diagnosed? What if there wasn't an Affordable Care Act allowing her to pay the extra money to keep me covered on her plan? I can tell you that one illness, similar to the one I've been through, or an accident, would have changed anyone's life in my position, possibly forever. One major illness or accident for an uninsured or underinsured person can put them into debt, it can wreck their credit, it can disrupt their education and take them off of their career path. When I think of college students, I have to think that it wouldn't just impact the college students. Those effects would go on to their families, and it would have a very negative impact on their future. Not every parent has a health plan to keep their kids on. At my age, my future shouldn't depend on the luck of the draw. I shouldn't have to worry about whether I can afford to get sick or have an accident. Representative Antonio and Councilwoman Cleveland have mentioned some really great benefits of Obamacare for women. I'd like to underline one that's very important. On October 1st, which is coming up very soon, Ohio's health insurance marketplace is going to open. I'd like to encourage every young woman out there who doesn't have health insurance to do some research, get the facts, and look into purchasing your own health insurance plan. Thanks to provisions in the Affordable Care Act, health insurance companies have to spend at least 80% of your dollar on health care. Thanks to the Affordable Care Act, they can't deny you because of pre-existing conditions. And they soon won't be able to charge you more than a man for the same coverage. Thanks to the Affordable Care Act, that policy you purchase will be required to offer you preventative services such as Pap screenings, cancer screenings, gestational diabetes screenings, completely free. It will also cover contraception. When you're a student and you have to worry about paying student loan debt, that $50 a month or the costs for co-pays goes a long way. We know that preventative care is much cheaper in the long run than waiting for an issue to get bad enough that it needs more expensive treatment. I'm not here to say that Obamacare is perfect. I'm here to say that our current healthcare system is not perfect, though. It needs work. It's the job of Congress to implement the laws and make Obamacare work the best for American people. Since my battle with cancer, I figured out something else. Without the Affordable Care Act, my cancer would have shadowed me for the rest of my life. It would have been a pre-existing condition. I would have had to consider that when thinking about leaving a job or starting a new job. Starting next year, insurance companies will no longer be able to deny me coverage based on a pre-existing condition. This creates more opportunities than I would have had previously as far as my career and my family. I get to have a life without being held hostage to my medical history. Thank you all for being here. Thank you to Protect Your Care and Organizing for Action. Thank you to Representative Antonio and Councilwoman Cleveland. And thanks everyone for bringing positive attention to healthcare reform.
Thank you.
I'll throw this out to anyone